Today, we're going to tackle a really baffling medical mystery. It's a story all about your body's incredibly intricate electrical wiring and what happens when that system gets totally scrambled, leaving everybody just searching for answers. Let's dive right in.
Okay, so imagine this. You've got weakness in your shoulder, maybe some numbness in your thumb, but your pinky finger feels totally fine. Or let's say your hip is weak, but your ankle feels perfectly strong. The symptoms are real, for sure, but they just don't follow a simple path, you know? It's not a single pinched nerve. It's this confusing, patchy set of signals that can leave both you and your doctor scratching your heads. So what on earth is going on?
All right, to get to the bottom of all this, we're going to go on a little diagnostic journey together. We'll start with this confusing problem, then we'll map out the body's nerve superhighways, figure out what causes a traffic jam, meet the detectives who crack the case, and finally look at the path forward.
So, first things first, let's put a name to this mystery.
The condition is called a plexopathy. So think of a nerve plexus as this massive, super complex junction box for your body's wiring. You've got all these nerves coming out of your spinal cord, kind of like individual cables. But before they head out to your arm or your leg, they hit this plexus to get sorted, bundled up, and rerouted. A plexopathy is what happens when the problem isn't with just one of those wires, but with the whole junction box itself. And that right there, that explains perfectly why the symptoms are so patchy and widespread. The damage is happening right at the central hub.
To really get this, we need to take a closer look at the anatomy of these incredible nerve superhighways.
Your body basically has two of these main hubs. First, there's the brachial plexus. That's the superhighway for your entire upper body. It starts up in your neck and runs all the way down to your armpit, controlling everything in your shoulder, arm, and hand. Then you've got the lumbosacral plexus, which is tucked away deep inside your pelvis, and it's the command center for your leg.
And what's just wild is how organized this whole thing is. I mean, it looks like chaos, but it's not. The nerves from the spine don't just shoot straight down to your arm. No, they go through this really sophisticated sorting station. They merge and split at different points, from roots into trunks, then divisions and cords. The big takeaway here is that an injury at one of the early stages, well, that's going to create a totally different set of symptoms than an injury way down the line. It's all about location, location, location.
Okay, so we know the layout of the highway now. But what actually causes the traffic jams?
Well, the causes really fall into two big buckets. On one side, you've got traumatic causes. These are those sudden, high-energy events. Think of a motorcycle accident that stretches the whole network, or even a heavy backpack that's constantly compressing it. On the other side, you have the non-traumatic causes, and these can be way more sneaky. We're talking about things like a tumor slowly growing and pressing on the nerves, a weird inflammatory condition, or even damage that only shows up years after something like radiation therapy.
You know, a really fascinating non-traumatic example is this thing called neuralgic amyotrophy, sometimes called Parsonage-Turner syndrome. It's basically an inflammatory attack on the plexus. And get this, it can be triggered by something as common as an infection or even a vaccination. It usually kicks off with this sudden, horrible pain in the shoulder. And then, just a few days later, the pain goes away, and it's replaced by this disabling weakness and muscle wasting. It's a classic case of the body's own immune system causing a huge roadblock on this nerve highway.
So with all these possibilities, how in the world do doctors figure out what's wrong, and more importantly, where it's wrong? Well, this is where the diagnostic detectives come into play.
The investigation follows a pretty logical path. It always starts with a really thorough clinical exam, just mapping out those specific patterns of weakness and sensory loss. Step 2 is where they bring in the electrodiagnostic studies, like an EMG. This is where they test the electrical signals in the nerves to find out where the disruption is. Think of it like an electrician testing the wires in your house. And finally, step 3 is advanced imaging, which lets doctors actually see the nerve superhighway directly.
And as this quote really drives home, the real magic happens when you combine different imaging tools. Synergistic application. That's just a fancy way of saying that using ultrasound and MRI together gives you a picture that's so much clearer than either one could on its own. And this is a total game changer, because a fast, precise diagnosis means getting the right treatment sooner and avoiding a bunch of unnecessary invasive stuff. So, let's peek inside the toolkit. Ultrasound? It's fantastic. It gives you this incredible, high-resolution view of the nerves close to the surface, and you can even do dynamic tests, watching how the nerves move in real time. But it really depends on who's doing it, and it can't see through bone like your collarbone, and that's where MRI swoops in. MRI is the absolute gold standard for looking at those deep structures like the nerve roots right where they pop out of the spine.
It gives amazing pictures of all the soft tissue and can spot problems like swelling or even when a nerve root has been torn clean off. They really are the perfect team.
And check this out. This is an amazing little detail. An MRI can actually see the consequences of nerve damage almost right away. When a nerve gets injured, the muscle it controls starts showing signs of distress, like swelling. And that signal shows up on an MRI in just 24 to 48 hours. So that means, even before the nerve itself looks all that damaged, doctors can see its footprints in the muscle. It gives them this critical, super early clue to help pinpoint the problem. How cool is that?
So, once the detectives have cracked the case, what's next? Well, that brings us to our final section, finding a path forward.
The path forward really depends on the cause. If it's a tumor, you treat the tumor. If it's an inflammatory attack, you work on calming the immune system. But for a lot of people, the journey comes down to two key things: managing some pretty severe nerve pain and grinding through intensive physical therapy to keep everything working. And in the most severe traumatic cases, surgeons can do these incredible procedures, like nerve grafts or tendon transfers, essentially rewiring the limb to bring back some movement.
And that kind of brings us to our final thought here. The technology for seeing these nerves is just getting better every single year. I mean, techniques like MR neurography can create these mind-blowing 3D maps of the entire plexus. So it really makes you wonder, right? As our view of these nerve superhighways becomes crystal clear, could we one day not only diagnose an injury with absolute precision, but maybe even predict its chances of recovery, giving everyone a roadmap for the future before the healing has even started? It's a pretty exciting glimpse into what's next for neurology.